Once you get prostate cancer, can your diet and your lifestyle slow the progression of any stage of the disease?
Yes, I think it absolutely can. We actually published a systematic review about a year ago of all of the studies that are about plant-based diets and prostate cancer. That is like vegan or vegetarian diets. And there's actually been several interventional studies looking at this, where they actually had people start one of these diets and looked what happens. And basically, it's been studied in two different contexts, which basically encompasses the realm of survivorship. So the first context that it's been studied in is men who have prostate cancer who haven't been treated for their cancer or they're undergoing active surveillance. And that was a randomized trial that was done by Dean Ornish, who I believe was on this podcast previously as well. And in that randomized trial, there was less progression among the people who adopted an intensive lifestyle intervention that included a vegan diet as well as physical activity and stress reduction. So definitely we have data from a randomized trial in that context of men with prostate cancer who haven't had treatment yet. Then on the other end of the spectrum, there have also been trials in patients with prostate cancer who already had treatment but are experiencing recurrence of the cancer after treatment. And what they found is that after these individuals started on the plant-based diets, there was actually a slowing of their rise in PSA compared to the rate that it was rising before they did the diet. And if they, stopped doing the diet, then the rise started going back up again, essentially. So those are definitely, two different scenarios that
Yeah.
encompass a lot of what we're looking at in terms of patients already diagnosed with prostate cancer. And those, by the way, those are studies related specifically to, progression of the cancer.
Yeah.
Actually, just about a week ago, we published a paper using data from the health professionals follow-up study. This is an extremely large study that's run out of Harvard University. It's not a clinical trial, it's a cohort study. So they look at people and what they do over time. And we looked at more than 3,500 men with a history of prostate cancer. And most of them actually had already had radiation or surgery. And we found that those who ate more plant-based had better scores for erections, better scores for urinary function, and more vitality, things like energy. And so, bottom line is I think it seems like it's a good thing for both the cancer as well as some of these related issues like sexual function and urinary health that are really some of the main problems that are experienced in the prostate cancer population.